Do you know what causes snoring? This nocturnal nuisance that keeps half the world awake at night has more to it than just being an annoyance. Snoring is a common condition that can affect people of all ages. It's a noisy breathing while you sleep. It's a common condition that can affect anyone, although it happens more often in men and in people who are overweight. Snoring tends to get worse with age. It occurs when the flow of air through the mouth and nose is physically obstructed during sleep. This turbulent airflow causes the tissues of the throat to vibrate, resulting in that all too familiar sound that can range from a gentle rustle to a thunderous roar. But what exactly causes this airflow obstruction? Now, the answer lies in a combination of factors, including the anatomy of your mouth and sinuses, alcohol consumption, allergies, a cold, and your weight. Sleeping on your back can make you snore, so can using a pillow, that's too soft or too large. Sleep deprivation can contribute in the way your throat muscles might relax too much if you're not getting enough sleep. Yes, that's right, even your weight can play a role in whether you're a snorer or not. When it comes to diagnosing snoring, it's often as simple as having a bed partner who can confirm the noisy fact. However, in some cases, a sleep study or polysomnography may be recommended. This involves monitoring your heart, lung and brain activity, breathing patterns, arm and leg movements, and blood oxygen levels whilst you sleep. But fear not, snorers of the world, there are treatments and remedies available. Many snoring treatments are available over the counter in pharmacies, but most do not cure snoring. There are, however, a number of steps you can take to put an end to your snoring. Here are some tips for the snorer: lose weight and improve your eating habits. Avoid tranquilizers, sleeping pills and antihistamines before you go to bed. Avoid alcohol and heavy meals or snacks at least 4 hours before you sleep. Establish regular sleeping patterns. For example, try to go to bed at the same time every night. Sleep on your side rather than on your back. Raise the head of your bed up 4 inches. Raise the whole bed, not just pillows. Try nasal strips, flexible bands that you stick to the outside of your nose, and keep nasal passages open. Wearing an oral appliance when you sleep keeps your jaw in the proper position so air can flow. Your healthcare provider might call it a mouth device or a mouth guard. A mouth guard used for other purposes like sports won't resolve snoring. If none of these tips helps, talk to your doctor. There are a variety of medical treatments that may reduce or eliminate snoring. Other remedies such as sleeping on your side, raising the head of your bed, or using a humidifier can also be beneficial. For those with more severe snoring issues, medical treatments may be required. For mild forms of snoring caused by swelling of the lining of your nose, a doctor may prescribe a steroid nasal spray to take before going to sleep. They may also suggest dental appliances or nasal strips. For more severe forms of snoring due to sleep apnea, surgical procedures or continuous positive airway pressure may be prescribed. Continuous positive airway pressure CPAP is a treatment in which a mask is worn over the nose and or mouth while you sleep. Surgery may be needed to correct a physical problem that is causing you to snore. Consult to your doctor. However, it's important to remember that snoring can sometimes be a sign of a more serious condition known as obstructive sleep apnea. This is a serious sleep disorder that requires medical attention. So if your snoring is accompanied by symptoms like excessive daytime sleepiness, morning headaches, or waking up gasping or choking, it's best to seek medical advice. To summarize, snoring is a common condition caused by the obstruction of airflow during sleep. Factors like mouth anatomy, alcohol consumption, allergies, colds, and weight can contribute to snoring. Diagnosis often involves a bed partner's observation or a sleep study, and treatments range from lifestyle changes and home remedies to medical treatments. But remember, snoring can sometimes be a sign of a more serious condition like obstructive sleep apnea, so don't hesitate to seek medical advice if needed. So the next time you're kept awake by the sound of snoring, remember it's more than just an annoying sound. It's a complex condition with a range of causes and treatments, but with the right approach, it's definitely something that can be managed. Sleep tight,